You're listening to In Network, Nordic's podcast series where we explore healthcare and technology with experts from around the globe.
Hello, and welcome to the In Network podcast feature, Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph. I recently sat down with Sarah Krug, CEO of Health Collaboratory and Executive Director at Cancer 101. We chatted about Sarah's work on things such as the Magic Wand Project, designing in the health space to improve trust, and doing the patient-doctor tango. Let's plug in. Sarah Krug, welcome to the pod. It's great to have you.
Thank you so much for having me, Craig.
I am very excited about this talk because we are going to be talking about confessions. We are going to be talking about magic wands. We are going to be talking about Shark Tanks. These are all things I don't generally get to talk about. So I think this is going to be great. Why don't you tell us a little bit about where you are now and how you ended up at this place where you are doing all these cool things?
Thank you. So I'm a researcher by trade. I'm a patient advocate by choice. I've worked across sectors. Started out at a cancer center called Memorial Sloan Kettering with a focus on building disease management pathways. I was at Pfizer for about a decade, starting out in research, transitioned into medical education and patient advocacy. And then today I wear two hats, leading two organizations as CEO of the Health Collaboratory. And that's basically a global innovation hub focused on cultivating trust and bridging gaps across healthcare by amplifying the raw and diverse voices of the patient, the care partner, the clinician in the co-design of healthcare innovations. And then I'm also executive director of Cancer 101, which is a patient advocacy organization that helps patients and their families navigate healthcare in partnership with their healthcare team. That
is, you are a busy person. So one of the projects that you had told me about when we were preparing for this talk was the Magic Wand Project, which first of all, I love the name. Can you tell us a little bit about, where that name came from, what you were trying to achieve and how you achieved it?
So the name, I feel like if healthcare doesn't work out for me, I would love to pursue a career in naming projects. I like to come up with interesting names. I have an idea book that I carry around, and I have a whole chapter on just names that I want to give to some of our innovations over time. But the majority of our innovations, they stem from a simple question. If you could wave a magic wand and change one thing about healthcare, aside from making it free, what would you change? And so we asked the community that question. We got over 10,000 responses. So we had all this data. There were some interesting responses, some simple, others a bit more complex. And we bucketed the issues into different categories and combined that with focus group data to really identify the barriers that people were facing. So we wanted to understand what was out there, what was working, what wasn't, and why. And where we found gaps, we ended up co-designing solutions with patients. Well, I should say patients, care partners, clinicians. And that's really our secret sauce, ensuring that we don't just create something because we think it's a good idea. We take the time to understand the pain points and then work with patients and others to co-design those innovations. And it doesn't matter what field you want to innovate in. It's just really important that you take the time to understand and listen to your target audience and then obtain their perspective as you're building the innovation. Because, we all know that if you build it, they don't always come. And yes, I'm a patient advocate, but I'm also a clinician advocate. And there are times we in healthcare develop patient engagement innovations that in turn introduce workflow constraints for the clinician, and then it doesn't work. So clinicians and other important stakeholders have to be involved in order for us to co-design and go beyond a bunch of colorful Post-its.
Yeah, I think this is a key point that a lot of people miss, including myself. If you're trying to design a better workflow for cardiologists, yet you get your subject matter expert is the chief of cardiology, who barely practices and barely follows the same workflow that everyone else does. You might get answers, but they may not be the best answers. And so, understanding who your audience is and then getting a representative group is much easier. It sounds very easy, but in fact, it can be difficult and lead you astray when you design the most amazing thing and no one uses it, and then you wonder why.
Absolutely. And I often say that innovation isn't about technology. It's not about the shiny new car. Sometimes it's about paving that smoother path for an old car to travel down and thinking about a back to basics approach. And, one of our first co-designed projects was tackling one of the Magic Wand projects, Banish the Free Show hospital gown, which makes me feel dehumanized and exposed. And in that project, we brought together 25 patients. We brought in clinicians to talk about accessibility. We brought in fashion designers and seamstresses and looked at previous redesign efforts. And then we engaged in, again, what I call a participatory co-design process and created a new hospital gown, which is a cross between a kimono wrap top and basketball tearaway pants. And we're not going into the hospital gown business. The intent here was to show how easy it is to partner with patients to co-design a solution based on issues they've identified. And we didn't anticipate we'd get flooded with requests for the new hospital gown because it was just a project to illustrate how easy, but that was a fun project for sure.
That's great. And certainly it's one of those things where you don't really think about a hospital gown until you're a patient and you have to wear one for a long time. And then it becomes a big ordeal. And so I, again, think focusing on the right audience, kind of asking people, even something that seems minor. Hey, especially if you're having a minor procedure, you're only going to be there for half a day or so. It can be a big thing. And like you said, when you're kind of exposed, you feel very vulnerable. And that is not the feeling that we want when you're engaging with a healthcare team. So kudos to you for trying to solve that problem and for making it fashionable too, because we want to look good before that colonoscopy or that operation, I think.
Yeah, I think the added touch there with the kimono was the basketball tearaway pants, where obviously we had to think about things like if you're in an MRI machine, what are the materials you use, et cetera. But yeah, that's something we actually created it and we debuted it at a few conferences. But again, we haven't gone into the hospital gown business just yet.
All right. Well, it's always, there's always the future there. I can just see if you're incredibly successful, people faking their way into the hospital simply so they can access your tearaway kimono combination. That would be great.
Yeah. Now I just have to partner with Dolce & Gabbana and then we'll be set.
So the Magic Wand project, one of the things, since you got so many requests, one of those was the hospital gown example. Were there other examples of things that came from the Magic Wand project?
Yeah. So all of our innovations actually, again, stem from the Magic Wand project. So I need a health GPS to help me navigate healthcare. That led to our Prescription to Learn platform, which is essentially an ecosystem to navigate resources from credible sources in an era of misinformation and just a ton of information. Patients don't know where to start. Patient Pathway was another innovation that was geared towards taking guidelines in cancer and creating a bird's eye view for patients to understand and track their symptoms, track their medications over time, understand treatment options, things of that sort. Patient Cliff Notes was a tool that we created to provide people with simplified education and the initial stepping stones when they're first diagnosed. I call it day one education. So I don't know if you remember the Cliff Notes. I know you didn't use them, Krug, but the Cliff Notes when you were in school, you had a Cliff Note for every book or a subject. So we essentially took that concept and created the Patient Cliff Notes to provide, again, simplified education when you're first diagnosed, recognizing that patients don't want to be overwhelmed with a ton of information at that point. They're going through an emotional journey. And so the point was just to provide them with the basics and then layer in additional content over time. And then there's the Tequity tool. So Tequity, I refer to the concept Tequity as the moment when health equity and digital literacy collide. It's really an opportunity to democratize health by recognizing we all have different preferences, right? And there's often a misconception that just because I own a smartphone or I have access to the internet, that I have digital literacy proficiency when it comes to healthcare. And we can't forget again about the fact that we all have different preferences. We may learn in different ways. And so as we explore the next frontier of education and data access, it's important we prioritize those preferences. So we developed the Tequity tool, which is focused on capturing how people prefer to receive information based on different healthcare interactions. And it allows people to share their preferences and digital needs around different types of healthcare interactions with their clinicians so it can be personalized accordingly.
I love all of that. The idea of Cliff Notes is great. I don't, again, for the record, know what those are. And when I read Virgil's The Aeneid, in high school, I assure you that I did not look at the Cliff Notes.
How about the
If
Fountainhead? Did you ever read that book?
Ayn Rand.
Yes.
Yes, I did read that. I don't know. Did I read the other Cliff Notes for Ayn Rand?
I think there were. I mean, I
Okay.
wouldn't know either. I just came up with that
No,
concept out of
no,
the
of
blue
course
as
not.
well.
Yeah,
But yeah,
no, neither of us would know about that. However, though, the point of, hey, we're just going to talk to you right now about this new diagnosis that you probably know very little about, and give you the things that you need to know now, but kind of just give you the information that you want to know without overwhelming you. And that's really complicated, right? Because people are gonna learn about their diseases very quickly when they get a scary diagnosis or a chronic disease type notification, and giving them the information that they need at that time, and then being able to build on that over time is sounds pretty straightforward and simple, but I don't think it is. And you have to, as you mentioned, you have to meet the patients where they are at that time, and so it takes a lot of a thoughtful process. So again, kudos to you for kind of taking on that necessary role. If you just go to the internet, who knows what you're going to see, right? I think that's certainly appropriate maybe on week 2 or week 3 once you've got your sea legs. But at the beginning, this could be a big difference.
Absolutely. And the intent also over time is to start to personalize the type of education that we receive based on even the emotions we're experiencing, right? Day 1, you're in distress. You just found out you have cancer or another health condition. You're distraught, and it's in on one ear out the other. And so the idea is to really think about the emotion that patient and or care partners experiencing, and then tailor the type of content they receive, layer it in. We don't learn French in a day when we're signing up for a class. Why are we expected to learn about our condition so quickly and then make life-altering decisions? And so it's really important we think about the emotional journey. We think about the learning readiness, the preferences that people have around different types of technology. Not everyone is necessarily comfortable with utilizing their mobile device to consume healthcare.
Sure.
But today, we think about paper at the point of care, and that's almost gone at many institutions. So we really have to think about reaching people where they are and bringing them to where they need to be.
Yeah, it sounds like a good use case for generative AI at some point. All right, so then you could have a general template of what you're going to be, what information you're giving, but it's probably very different for a 20-year-old than for a 70-year-old, or someone with advanced education versus someone who doesn't have that, and kind of again focusing and tweaking it so that everyone gets a somewhat personalized experience.
Absolutely. AI is something that we've started to incorporate into our Patient Shark Tank. So Patient Shark Tank is another platform that we developed to engage different types of people, whether it's education, whether it's socioeconomic status, whether it's race, ethnicity, their preferences around technology. And when we think about engaging patients today, we typically reach out to patient influencers or expert patients who might be on social media. We reach out to patient advocacy organizations. We aggregate data through online communities. We engage volunteers through PFACs. And those are all important channels, but how do we ensure that we're not leaving the other patients behind as we're thinking about things like AI or these other innovations we've been talking about? Many patients don't go online to share their healthcare experiences or even publicly admit they have a condition. Many are not reaching out to patient advocacy organizations on day 1. So how do we ensure that these patients are part of our conversations as well, so that our innovations and our data, they're not biased towards those that are more engaged with these channels? So I created the Patient Shark Tank to amplify the voice of the patient, the care partner in the design, in the development, or continuous improvement of healthcare innovation, whether it's tech, research, clinical trials, education. And we've engaged over 25,000 patients and care partners across conditions globally. And there are different models we use to engage them. And then we've co-designed it's a 12-part proprietary scorecard they use to assess the innovations that's used to provide structure to an assessment, but it also gives patients and care partners that opportunity to reflect on their unique experiences, their unique perspectives. And again, although there are expert patients and care partners who are part of the Patient Shark Tank, the majority haven't interfaced with anyone in the healthcare ecosystem outside of the healthcare team. They're not going to conferences. They're not on social media talking about their condition. So as we build out things like generative AI, it's imperative that we bring in the perspectives of those that are typically not as engaged to understand those viewpoints and understand whether or not, there are constraints to utilizing that in healthcare over time.
Sure, and I think one of the aspects that you've talked about is ensuring that you're designing to improve trust, to allow the person that's leveraging the innovation, often the patient or the family, to trust that this tool, this innovation, this workflow, this technology is actually there to help. Tell me a little bit about what you've done specifically about trust.
So an important piece of evaluating an innovation is evaluating the terms and conditions that come along with that innovation. And that's typically something we all don't necessarily read. And so what we have patients do is we have them assess the terms and conditions using this scorecard.
Mm-hmm.
And then once we are finished with the translation, because oftentimes they don't understand the verbiage used in the terms and conditions, once we translate that, and then provide them with the specifics around scenarios and provide them with additional context, then we ask them whether or not they would potentially utilize that tool. And it helps move the needle as it relates to whether or not they would use that tool because they don't trust it, what would make this more accessible to them. And so the recommendation I often have for all organizations developing innovations is simplify the terms and conditions so that patients don't have to look up terms. And if the legal folks require that you have those legal terms in the 50-page terms and conditions, create the patient Cliff Notes version, create the simplified version up top so patients and their care partners understand what they're signing up to. Because the last thing that you want is for patients to get upset after they've utilized that tool. Mm-hmm. And I can think of different organizations out there that have gotten in hot water over time because patients didn't necessarily understand how their data was going to be collected, protected, shared. And I often say that transparency is one of the most disruptive innovations of the 21st century. And so it's critical that people know how their data is being utilized over time and understand the specific nuances around how we define things like research. And I'm not going to name any names, but I think it's just important for people to be aware of how their data is being utilized. And that starts with the terms and conditions, and that can help build trust over time with healthcare, because trust is at an all-time low. We actually created something called a trustometer that helps assess trust between patient and their doctor, trust between patient and the healthcare system, and then trust in research and science. Unfortunately, the silver lining to the pandemic was that everyone started to understand clinical trials, right? The term clinical trials became that household name because it was all over the media. But the unfortunate part is that when people were learning about the vaccine and race to the cure, they also thought that perhaps we were cutting corners, that there was, a lot of things that science was doing that wasn't necessarily in the best interest of the patient. And so that led to a lot of mistrust in healthcare. And the ripple effect is that it didn't just, stay with COVID per se. There was that ripple effect into other parts of healthcare. So trust in healthcare is at an all-time low. I can go off on a tangent on this for days, but it's really important people understand how their data is being utilized.
Yeah, well, I certainly consider transparency a core part of human-centered design. So they understand how an elevator works, and so they understand how their data are being shared, and who's seeing what, and when and how. And sometimes it's limiting, right? And so it's easier from that third-party perspective to bury the details in these big legal forms. But as you point out, it often can come back to bite you. And I think also the opposite can be true, where people are like, oh, well, why are we not sharing this even more? I want others to be able to benefit from what I'm going through so that they may not need to go through it. And you might be surprised of the desire of people to share information that might be private or personal if it can be kind of thrown into a larger group, and if the benefits are clear. I think that's often where the problem lies, where I don't really understand what you're going to be doing with this information, nor how it could help people like me.
Oh, absolutely. We have many patients that are very comfortable sharing their stories and their data openly. They put it up into crowdsourcing platforms. They talk about it at conferences. They talk about it on social media. And those are all very important voices. I think for me, it's just ensuring that as we're developing innovations, we're recognizing, we just had a session with people who had prostate cancer. And many of them hadn't even told their family they have prostate cancer. And that was enlightening. It's important to recognize that there are people who aren't as comfortable sharing, but we have to figure out a channel for them to engage. Just because they don't necessarily want to share doesn't mean that they don't want to be engaged. So figuring out how to anonymize their data, anonymize their stories, anonymize their assessments, providing them with a safe space to participate, to co-design. They still want to be part of the conversation. They just have to be provided with channels in which to do so.
Yeah, well, absolutely. Pivoting a little bit, although not that far, you talk about kind of interactions between patients and their physicians. You've packaged it up in something that we can all understand, the tango. Now, I have to be clear, I cannot dance in any way, let alone something like the tango, but maybe you can, and you can tell us a little bit about the patient-doctor tango.
Yes. So the patient-doctor tango is a talk I gave a few years ago. So I mentioned earlier that I'm not only a patient advocate, but I'm also a clinician advocate. The patient has a life expertise that's just as important as the doctor's medical expertise. And only when the two come together and engage in that embrace, or what I refer to as the patient-doctor tango, can it lead to that powerful connection and ultimately a flawless performance. So I use tango as an analogy because the key elements of the partner dance are the foundation to the ideal patient-doctor relationship. In the ideal patient-doctor relationship, life expertise of the patient, that's embraced in partnership with the doctor's medical expertise, which is the essence of participatory medicine, which is the type of medicine where both patient and doctor are equal partners. I've gotten questions from people, well, what about the nurses? What about the other members of the care team? So tango is a two-part dance, or two-person dance, I should say. So I haven't figured that piece of the puzzle out. I'm still working on the naming for that. But for now, it's really perfecting that relationship between patient and doctor through the tango.
Fair enough. It is a team sport, but those are the two of the major players there. So that absolutely makes sense. So you were doing this patient-doctor tango talk, and certainly the ideas are appreciated and well delivered. But when we were preparing for this, you talked about a design fail that came out of that talk, and I'd love to hear more about that.
So I'm almost too embarrassed to admit this. Not many people know this story, and I can laugh about it now, but it was pretty traumatic. So I was giving this important talk in Europe, patient-doctor tango. I bought a dual voltage curling iron with an adapter to give my hair a little zhuzh, spruce it up a little bit. And then 2 hours before the talk, I'm fully dressed, ready for the presentation. And again, I'm going to add a few curls. I sound so vain, but I promise you I'm not. Anyway, all of a sudden, there's this peculiar odor, burning plastic. I see smoke. The curling iron is on fire. Throw it down on the floor, put the fire out. I didn't burn down the hotel or my hair, thank goodness, but I look in the mirror and now I look like Jekyll and Hyde. One side's pinned straight, the other side's curled. It was hideous. Run downstairs, the front desk. I ask for nearby salons. They give me 3 locations. The first 2 fully booked, don't even acknowledge my crisis. The third has an appointment that's running late, and I plead 5 minutes just to make me look normal. I'm about to go on stage. So the stylist quickly curls my hair, holds up the mirror. I have long hair, but my hair is curled so tight it barely passes below my ears. I look like a Shirley Temple poodle. So I'm not sure which is worse, Jekyll and Hyde or Shirley Temple poodle. I'm running late for the talk. I don't have time to fix it. So I thank him, rush into a taxi, come up the curls in the taxi, doing everything in my power to look somewhat like myself. And I barely make it on time. I'm rushed on stage, out of breath, and I give my talk. So I'm traumatized by that experience. I'll never buy a dual voltage curling iron with an adapter again. That's one design fail that I have to make mention of on this call.
Well, we can't blame you for that. It sounds like you did all the right things. Do you have? I think the audience would certainly enjoy pictures. If you want to send them to us, we can post them in the show notes. Is that a no? It seems like that's a no.
I don't. I will admit that I do not have pictures of the Shirley Temple or the Jekyll and Hyde. At the time, I didn't think to take pictures, but yeah.
Yeah,
If I did, I would not send them to you.
and I appreciate your honesty, although still I think the listeners demand it. And so maybe we'll look, if we get a lot of feedback, we'll look into trying to figure out if we can come back and redo that experience for you so that we can find that stylist and get some of those pictures to at least get a little bit of what that taste was. I think it'll be great for your career.
Or I could just buy another dual voltage curling iron and replicate that whole scenario.
But that seems from a safety standpoint. I can't be part of that. I can't have you risk your life. I appreciate it. I appreciate the offer, but no, we shouldn't have you do that. Are there any other design fails that came close that you want to talk about so that we can learn from your almost disastrous occurrences?
Yeah, so I do have another design fail. So I have a letter drafted to potentially complain about this one.
Ooh.
My Siberian Husky, aka Houdini, she loves to ride in the back seat of the car, and she's mastered the skill of opening the back window. And in my husband's car, there's this feature that locks the window, like childproofing, I guess. But when it locks the back window, it also locks my window in the passenger seat. And it drives me crazy that every time I want to open the window, I have to ask him to unlock it. So power locking passenger seat window or door, that should be optional. When I'm in an Uber, it's sometimes a little scary when you're power locked in and trapped as a passenger. So we need to rethink power locking. And why did that just feel like a therapy session?
It's good. And that's that you're recording a good podcast episode when you feel like you're getting therapy. I will need afterwards. I'll need your insurance card, and there might be a copay involved,
Yes.
but we can waive it. Don't worry, Sarah. I'm trying to be reasonable here with you.
But do you have that feature in your car?
I think I do. My dog does not have the intelligence or ability to open a window, but I see where you're coming from. I do think that mostly we're talking about childproofing, right? And generally, the children that we're trying to keep safe are in the backseat.
Right, exactly.
So it does seem a little weird that the passenger side and the front seat would be locked, unless your husband has specific concerns about your ability. I mean, have you tried to jump out through the window before? Because that's something we need to know about.
This is such an aha moment for me because perhaps there is no real power locking of the passenger seat, and it's all been my husband's doing. Always blame it on the husband.
I'm not, and just to be clear, I'm not saying that that's the case, but I'm also not saying that's not the case.
Okay, so I'm going to have to look into that. Perhaps I should hold off on sending the letter until I do some more investigative.
Yeah, and also I'd be interested to know if I think there's a new TV show called Stupid Dog Tricks, something along those lines. Your dog might have some skills to get you on national television.
She also does say I love you, so I think we would audition for that for sure.
For sure. Like, this is a no-brainer. I feel like that might be one of the most important things that we've learned about today, that your dog can speak and can control the windows in the car.
I'll send you a video of her saying I love you. And my 14-year-old, she's now 14-year-old, my 14-year-old Husky is a liver cancer survivor. She just beat cancer. So yes, she's. I had to figure out a way to work her into the podcast for sure.
Yeah, well, you've certainly done so. So you had an experience after giving one of your patient Dr. Tango talks. That's hard to say, where lots of folks wanted to come up and meet you, but not for the reason that you had thought. Can you tell us a little bit about what happened?
So I gave the patient Dr. Tango talk, which was focused again on the cornerstones of improving the patient-doctor relationship. And during the talk, I asked the audience, how many of you have asked Dr. Google a health question you would never ask your doctor? How many of you have lied or withheld a few details during a visit with your doctor? And then I confessed what I lied to my doctor about. And about 50 people were lined up to talk to me afterwards, not to talk about the patient Dr. Tango, which was the whole theme of the talk. But one by one, they came up to confess what they had also lied to their doctor about. And so began the Health Confessions Project. So I've been working on this project for several years where I've collected over 5,000 anonymous confessions of what patients conceal or lie to their doctor about. And as a researcher, I looked at the main trends and then further studies why people were lying and what the potential ripple effects or the consequences of those lies might be. And initially, I was working on a research publication that might wind up in a journal that the layperson might not have access to. And I wanted to get this information into the hands of the average person out there, concealing elements of the truth. Because if I could educate them on what we're all lying about, why we're lying about it, and the potential consequences of those lies, it might empower us all to make better decisions on what to share with the doctor. And that's the premise of the book that I'm working on called Health Confessions.
I love it. And since we're doing the confessing, I will say that I lie about my height. My doctor thinks that I'm 6'2", and I hope that doesn't have any impact on my health, but I'm coming clean now. So if my doctor's listening, he knows what to do with that information.
Surely we can get something juicier than that. But it's interesting that you bring up height, because that was something that people lied about. And it's what people typically are. They say that they're taller and they're really shorter. And then sometimes people lie about weight, but that's on the far left of the spectrum of the lies that we tell.
I also, when I told you, I tell them I'm 6'2", it's because I'm actually 6'5". So I'm trying. No, anyone that knows me, I'm quite short. So yeah, I understand that. I don't know that I would get away with it at the doctor, but I totally understand some things not wanting to share, and sometimes because they're embarrassing or you think you're going to be judged. Other times, though, you didn't think it was important, and so I get that. I look forward to kind of hearing more about that when your book gets closer.
Yeah, and so it's interesting because yes, embarrassment, judgment, those are all reasons people don't share certain things. But there's a new one that's surfacing where sometimes people don't want to share things because they're worried that now it's going to go into their medical record and be shared. And then they're worried about where that data will eventually go. So that's a new one that will be important for us to further assess and figure out over time.
Yeah, and that's, is that a feature or a bug of our current electronic health record system, right? When it's certainly something that most of us didn't worry about when we were recording our interactions on paper, because it was unlikely that information was going to leave the doctor's office. That's the good news with respect to confidentiality. The bad news is that information didn't leave the doctor's office, and so it wasn't available at the emergency room when you got into a car accident. Or for that super subspecialist that you've seen who could have used some of that information. So it's a double-edged sword for sure. It's not all goodness with easing the ability to kind of exchange information.
Yeah, and it's interesting. And I've finished majority of the book. I've just had this one chapter that's been a little bit of an issue to write, because again, if I present a problem, I like to potentially present solutions. And initially, I was trying to solve some of the issues that were coming through as to why people were lying to their doctor. And I've spoken to clinicians that asked me not to publish the book because they were worried that patients who would read it would then now conceal elements of the truth even more because of the technology issue. And so initially, again, trying to solve for that issue, and I spoke to many organizations and couldn't come up with the solution. And so I've decided that I'm just going to put this into the hands of the people, because I think it's important for them to know and understand. But then we as a healthcare system have to figure out solutions, because if that is one of the stumbling blocks, then that means that's something that requires additional co-design, right? Get people involved in co-designing the future of patient portals and the technology that's documenting, their secrets over time.
So true. Well, Sarah Krug, it has been a pleasure learning from you and speaking with you, and we look forward to the book's publication. We'll definitely try and get the word out when it comes out. And I think you're a force of good in the world, and I thank you for being there, and look forward to all the good stuff that you're going to produce in the future.
Thank you so much, Craig. It was really an honor to be invited to talk with you, and I look forward to hopefully being invited to another podcast in the near future.
Thanks for tuning in. We hope you enjoyed today's episode. For more on Sarah Krug and her work, visit cancer101.org or click the link in our show notes. Check back for more episodes of Designing for Health wherever you listen to podcasts or on NordicGlobal.com. Till next time, we'll see you in network. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.